Hello, my name is Adrian. I'm here. I just washed my hands. I'm here to do an assessment on you, okay? All right, so we're first going to start with a skin assessment. I'm going to look at your face, your neck, your arms, legs, soles of feet. Can I see the bottom of your feet? Okay, there are no lesions, masses, any kind of cuts, anything like that. I'm going to inspect your nail beds. Can I see your nails? Going to assess for capillary refill time. Everything is refilling. Can I see your other? In less than 3 seconds. All right, so next I'm gonna look at your head, all right? We're gonna do a bunch of stuff regarding your head. So I'm gonna inspect and palpate your skull. Is there any pain? Am I doing any of this?
No.
All right, so I'm gonna part your hair. Different, okay. I'm gonna palpate your temporal arteries. All right. So now I'm gonna do your temporal mandibular joint. Can you open your mouth? All right, very good. I'm gonna palpate your face and your sinuses. Okay. I'm gonna ask you to do a couple things, all right? Can you clench your teeth? Can you wrinkle your forehead, like raise your eyebrows? Can you smile? All right. Can you stick out your tongue? Move it right to left. Okay. Can you puff out your cheeks like this? All right. Can you squeeze? I'm just gonna test your eye strength. Can you close your eyes? All right. Try to open them. Okay. Next, I'm gonna look at your eyes. Okay. All right. Close your eyes. I just want to see the outsides. All right. I'm gonna palpate your lacrimal glands. Okay. So next, I'm gonna take a pen light, and evaluate your pupil size. So I'm going to shine the pen light at your nasal bridge from 30 centimeters. Okay, I'm looking at both of your pupils to see how they're reacting. I'm going to shine the pen light into your right eye. Look straight ahead, or look into the distance, I'm sorry. Behind me, look behind me. Behind me, straight behind me. All right. Okay. So next I'm going to tell you to look at this finger. Now look at the picture that's behind me. And then look at this again. Okay. So I'm going to be testing your extraocular eye movements. So follow my finger with both of your eyes. Okay. And then no, you go look. There you go. Okay. So I'm going to do an ophthalmic examination. I'm going to take my ophthalmoscope, my right hand, right eye. I'm going to look into your right eye. I'm going to be looking for any, okay. Left hand, left eye. I'm going to be trying to visualize the red reflex, lens, disc, cup margins, any vessels, and your retinal surface. All right, so next we're going to look at your ears. Make sure this is recording. Okay, it's recording. So I'm going to inspect your ears for size, shape, symmetry, and position. Okay. I'm going to palpate your ears. I'm going to push into the tragus. Is there any pressure? Okay, same on this side. All right, so I'm going to get behind you. I'm going to ask you to stick one finger in your right ear. Cover your right ear. Stick your finger in your right ear. I'm going to whisper a word. Tell me what word I'm saying.
Flat?
Okay. Now do the same for the other ear.
Baby?
Yes. Okay. Next, we're gonna do the Weber and the Rin test. So this is my tuning fork. I'm gonna hit the tuning fork, place it on your skull, and then you gotta tell me when you stop hearing it. Do you hear it in both ears?
Yes.
Okay. And then we're gonna do the Rin test. I'm gonna hit this. We're gonna do it on each ear. We're gonna start with your left ear. So I'm gonna put it on the mastoid bone. Tell me when you stop hearing it. Just say now whenever you stop.
Now.
Okay, I'm gonna put it here, and then say now when you stop hearing the noise.
Now.
Okay, I'm gonna do the same thing for the other ear. Hit the tuning fork, mastoid bone. Let me say now when you stop hearing the noise.
Now.
And then say now when you stop hearing the noise.
Now.
Okay, now I'm gonna do an otoscope examination. So I'm gonna start with your right ear. So can you tilt your head to the left side a little bit?
Like
Pull,
this?
yes, pull the auricle upward and back. And I'm gonna try to examine tympanic membrane. I'm gonna do the same on the other side. Pull the auricle up and back. Okay. Next, we're gonna do your nose. I'm gonna inspect the external position of your nose for deviation, no deviation. I'm gonna palpate your nasal skeleton from the bridge to the tip of your nose. Is there any tenderness, any pain?
No.
Alright, so can you cover one of your nose like this, one of your nares, and close your mouth and breathe in and breathe out? And then do the other nose? The other nostril, I'm sorry. And now I'm just gonna look into your nasal turbinates with a pen light. Can you tilt your head back a little bit? Okay. Next, we're gonna look at your mouth. So I'm gonna look at your lips with your mouth closed. There are no abnormalities. So I need you to open. I'm gonna take my pen light. Can you open your mouth?
Ah.
I'm gonna take a tongue blade, move your tongue around. Can you touch your tongue to the top of your mouth? Let me look under your tongue. Just keep your mouth still. All right. Once again, can you stick your tongue out and extend it from side to side, left, right? Okay. Next, I'm gonna open your mouth. Can you say open your mouth wide? Can you say ah?
Oh, wide?
Yes. Okay. And then we would normally test your gag reflex, but you don't want me to test your gag reflex. We don't have anything to test the gag reflex. Next, we're gonna look at your neck. So can you just tilt your head back a little bit? Not a little bit, only a little bit. Can
Like
you swallow?
this?
Yeah, to swallow. Okay. I'm gonna palpate your trachea for midline. So just keep your head straight. Okay. I'm gonna palpate your lymph nodes. Okay. I'm gonna palpate your thyroid gland using the posterior approach. Your crackle is there, okay. Can you swallow? Swallow again? Okay. Alright. Okay, and now I'm just gonna auscultate. For any bruise. Okay. Next, we're gonna I'm gonna stand behind you. You guys stay sitting. I'm gonna do a chest assessment. So I'm gonna inspect your posterior chest for symmetry and movement with breathing. Now just breathe normally. I'm gonna palpate your posterior chest. And when you hear my hands, when you feel my hands touch your back, I want you to say 99, okay?
99. 99. 99. 99.
Okay, so next I'm going to assess for respiratory excursion. So I have my thumbs at the 10th rib. I'm going to push it in. So I'm going to need you to take a deep breath in. Deep breath out. Okay, it was symmetrical. I'm going to symmetrically percuss your posterior lungs. So I'm going to auscultate. So every time you hear you feel the diaphragm, just breathe in for me, please.
Hmm?
I need you to breathe in every time you feel this on your back.
Okay.
Can you breathe in now? Okay. Okay, breathe in. 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 Okay, can you breathe in? Okay. Now I'm going to be in front. We're going to be doing your anterior chest. So I'm going to first inspect your anterior chest wall. Okay. So I'm going to listen to your breathing sounds from the front. Once again, when you feel this touch you, I just need you to take some breaths, to take a deep breath in, okay? Okay. 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 Breathe in, please. Breathe in, please. And then just gonna get over here. Breathe in. And then over here. Just breathe in, please. You can just stay just sitting straight. Okay. I'm gonna next listen to one of your heart sounds. So can you move your breast out of the way, please? And then I'm just gonna get right there. Can you lean forward? Alright, can you lean forward? Alright, can you lean forward, please?
Like this?
Yes. I'm just listening for any aortic regurgitation murmurs. Okay. Alright, so next I'm gonna need you to lay on the bed on your back. Are you alright?
Yeah.
On your back. Nice and comfortable. Just make sure the camera can see you. Alright, can you move up this way? So the camera can't see you that well.
Ow. Ow.
It's flat.
Okay, I'm sorry.
Okay. So I'm gonna start auscultating you again. We'll be listening to your heart sounds, okay?
Mm-hmm.
Alright. I'm gonna start over here. We're gonna listen first with the diaphragm, and then we're gonna need to do it again with the other side of the stethoscope, okay? Okay, I'm just gonna move this out of the way, okay? Okay. Now I'm gonna listen with the bell. We're just gonna do the same thing. Okay, I'm just gonna move this out of the way again. Okay. I'm gonna inspect your neck for jugular venous distension, so I'm just gonna place this under your head. Can you sit up this real quick? I just need to have you at a 30-degree angle, that's why. Okay, you can lay back down. You'll be looking at your, okay. There's no jugular venous distension. Alright. I'm gonna auscultate and palpate your carotid arteries that's around your throat. So, and okay. auscultate your carotid artery for any bruise, and then look the other way. All right. Okay. Next, I'm gonna auscultate your vascular sounds. So that's gonna be like around your abdomen. All right. I'm gonna do that with the butt of the stethoscope. So we're gonna start with aortic. We could do renal. For any bruise, there are no bruise. Iliac. And then it's gonna be femoral, so that's gonna be in your upper leg.
Mm-hmm.
Okay. Next, I'm gonna palpate all your peripheral pulses. I'll do it on both arms, so we're gonna do this real quick. Do brachial. Radial. Okay, femoral. Popliteal. Versalis pedis. Posterior tibial. And then we're just gonna go right around on the other side. Okay. That's a good pulse right there. Okay. Got all the pulses. So next, I'm gonna inspect your abdomen, so I'm just gonna lift your shirt up, okay?
Mm-hmm.
Okay, so can you cough? Cough harder. I just need to see if there's any palpate. Okay. I need you to keep your shirt up, please. So I'm gonna auscultate all parts of the abdomen. I'm just listening for any bowel sounds. Start with the right upper quadrant. Okay. I'm gonna percuss for the splenic sign. So I just need to find left axillary, lowest intercostal space, which is around right here. I'm gonna percuss. Okay, take a deep breath and hold it in. Okay, sounds good. I'm gonna palpate your abdomen. So that means I'm just gonna touch different parts of your abdomen. If there's any pain, let me know, okay? If there's any pain, any tenderness. So I'm gonna start here. It's gonna start light first. Just relax. And then we're gonna go a little bit deeper. Is there any pain?
Mm-mm.
Any tenderness?
Nope.
Okay. So next, I need you to take a deep breath. Right upper quadrant under rib cage. Okay. We are doing Murphy's sign, and there's no inflamed gallbladder. So next we're gonna do right lower quadrant. I'm gonna just let me know if there's any pain, okay?
Mm-mm.
Is there any pain when I release my hand? No rebound
No.
tenderness? Okay. So we're gonna palpate the liver edge. So left hand under 11th, 12th rib. Just around right here. Hand under my. All right, take a deep breath. As deep as you can. And then exhale as hard as you can. Okay. We're done with the abdomen. Okay, so I'm gonna do musculoskeletal now. So we're gonna just palpate your arms and legs. See, make sure they're even. Is there any pain when I do this?
No.
Okay. So first thing we're gonna do, we're gonna do some range of motion here. The first thing we're gonna do is your hips. All right.
Okay.
So just relax. I'll let you know what to do.
Okay.
So I need you to do a straight leg raise. So raise both of your legs. Okay. Next, bend your knees and bring your knee to your chest. No hands, no hands, just your legs. Yeah, just your legs. Do it again. Okay. So we do abduction. So I just need you to do like this with your legs. Okay. And then now cross your legs under each, like, yes, and then do the other way. Okay. We're gonna do internal rotation. So bend your knee, and then just bend your knee, and then twist this way. Okay, same thing with this one. Bend knee, and then and then do bend your knee again, and then no. Bend your knee, bend your knee, and then twist it outward. Okay, and then do the same for the other leg.
Like this?
Just use your hip to push it outward, like, and then yes, like that.
Okay.
And then I'm gonna test the strength of your hips. So I'm gonna do each leg. So can you do a straight leg raise with this leg? Okay. And then the other one. Okay. So we're gonna do your knees now. So I'll do one at a time. You do the draw sign. I'm gonna do the other knee. I'm just gonna bend this. Is there any knee pain? Anything like that?
No.
Okay. So I'm gonna check the fluids on your knees, alright?
Okay.
So I'm gonna okay, we're gonna do the other one. We're doing ballottement. Just relax your leg, please. I'm just checking. Okay.
Oh.
Next, so you could go into a sitting position again. Go on the bench. On the bench, please. So we're gonna do some more range of motion. We're gonna check your cervical spine. So, cervical spine is your upper back pretty much. So, first I want you to look up at the sky, as high as you can. And then now chin to chest, as low as you can. Alright, next you're gonna take your ear, look back, and then next, like, tilt your head as much as you can. Yeah, and then the other side. Alright, and now I want you to look all the way to the one side and then look all the way to the other side. Okay, now the other side. Very good. Next we're going to do your feet and your ankle. So we're going to do 1 foot at a time. Can you point this way and then forward? So that's dorsiflexion, plantarflexion, inversion, which is this way, eversion. So your toes, can you spread them out as much as possible? And now scrunch them up as much as possible. And then we're going to do the same thing for your other foot. So this dorsal flex, so point your toes back towards yourself.
Wait, what?
Dorsal flexion, like this.
Okay.
Plantar flexion, point your toes towards the wall. Inversion. Yep, X, okay. Abduction, take your toes and spread them out as much as you can. Spread them out. And then adduction, try to scrumple up your toes as much as possible. Okay. So next, we are going to do some neurological testing. So I'm going to take something sharp and something soft. I need you to close your eyes. All right. And I'm going to touch parts of your body. You tell me if it's sharp or dull, okay?
Mm-hmm. Sharp. Dull. Sharp. Dull.
Okay.
Dull.
This is sharp.
I don't feel anything.
Oh, maybe I'm not pressing hard enough. Here.
Sharp.
This is dull. All right, we're gonna do your chin. This might not. This is just a simulation. This might not be sharp or dull enough. All right. Can you close your eyes, please?
Sharp.
Okay.
Dull.
Okay. So next, I need you to close your eyes. Again, close your eyes. And you gotta tell me if I'm moving your fingers up or I'm moving them down, okay? So hold your...
Up.
Okay.
Down.
Okay. Keep your eyes closed. I'm gonna put something in your hand. You can try to identify it, okay?
Mm-hmm.
No, one hand.
Oh, I'm sorry. It's a cup.
Okay.
A pen.
Okay. Keep your eyes closed. I'm gonna write a number in your hand. You gotta tell me which number this is, alright?
Okay. Okay. Can you do that again, please?
Okay.
7?
Yes, and then we're gonna do it one more time in the other hand. Alright, we're gonna do it one more time. Maybe I did a bad job.
Is that an 8?
Yes, it's an 8. Okay. Alright. So next, you can open your eyes. What I need you to do is touch your nose with alternating fingers. So go like this as fast as you can. Okay? So next I need you to take your heel and run it down the front of your leg, tibia of your leg. Okay? Do the other one. Alright, so next we're going to do some deep tendon reflexes. So I'm going to start with your biceps. Okay, your triceps. This is me. No. Just relax. There you go. Next, I'm going to do your brachioradial. So 2 centimeters up from here. Okay. Your patellar, so that's your knee. Your Achilles. Alright, I'm going to do your other feet now. Achilles, patellar. Brachioradial. Brachial. And then your triceps. Okay. So next you need to stand up for me. Stand up. Move this bench out of the way so you can get into the camera. Let's move back a little bit. Yeah, I think they could. Okay. So we're gonna do some shoulder range of motion. All right. Stand here so the camera can see you. There you go. All right. So relax your shoulders. Shrug. Okay. So I need you to do flexion. So go as high as you can with your shoulders. Okay. Extension. So put your arms back down. Now you're gonna go as far back as you can with your arms. Okay. Abduction. So you're gonna put your thumbs out like this, and then as high as you can. All right. Adduction. So arms straight overhead. Now what you're gonna do is cross this as much as possible, like as much, and then the other arm. Okay, next we're gonna do internal and external rotation. So elbows on your, go like this, and you're gonna try to twist as much as you can without moving your elbows, pretty much but you want your elbows to be touching your sides, and then only using your shoulders. We're just testing the range of motion. Okay, and for external rotation, try to scratch your back like this, as high up as you can go. Okay, the other arm. Okay. Next we're going to do the same thing, but there's going to be resistance. So flexion, which is, going forward as high as you can. It's going to put a little bit of resistance. Just try, okay? All right, all the way up as high as you can. Okay. Extension, so I'm going to put some resistance in your back. Okay, push back. Okay, abduction. So that's the one where you go like this. So thumbs out. It's gonna, all right, so. Okay, adduction. straight arm, and you're just gonna try to, no, you're trying to go across the chest. I'm trying to push against it. Okay, we're gonna do the other arm now. Okay, we do internal rotation, so do this again, and try to push out against my arm. Okay, and then external rotation. Try to hit your back, but I'm gonna be pushing against.
No.
Yeah, go. Try to go up higher. Okay, we can do the other arm. Come on.
Oh.
Higher. Okay. And then we're gonna just do a shoulder shrug. Okay. We're almost there. All right, so we're gonna inspect and palpate your spine. So step forward for me, please. No. Just here. I just want to make sure the camera can see you. Okay. Maintain hand. Bend forward. I try to bend further. Bend forward further.
Like this?
Yeah, I just need to look at your spine.
Oh.
Palpate spinous processes.
There's a book on the floor.
Okay. So I'm going to be holding your waist. Straighten up again. And then you're going to laterally bend left.
What does that mean?
Like this. Basically, I'm going to have you be doing, look. You're doing left, right, and then rotate. So bend left.
Like this?
Well, right, that's right.
Left.
Yeah, left, right. Now do the twisting to left. Okay, and then twisting to the right. Is there any pain?
No.
Okay. All right, there's not much space here, but I want you to just take a few steps forward, a few steps back, just so I can assess your gait. Okay, gait is steady. Finally, I just need you to close your eyes. Actually, no, well, let's do this easier. Hop in one place on one foot. Can you do that? All right, no, never mind. Close your eyes. And then stand on one foot with your other foot.
Wait, so I'm going to close
your
my
eyes. And then take your right foot, step on your left foot, and then vice versa. We're just testing your neurological functioning. Okay, you're good. Thank you very much.